Hi everyone, Dinesh Surasena here, and today we're going to be talking about injections to the abductor tendons of the hip. So as with my previous video, I would suggest placing the patient on the opposite side with the hip that you want to inject exposed. You can also bend the hips and knees to 90 degrees, and this will be much more stable for the patient. It will mean that when you're undertaking the injection, it's also a lot more stable for you. So when undertaking the injection, I tend to use a linear transducer. I also tend to use a 21 or a 23 gauge needle. If you're coming in from a long axis orientation, the approach would be approximately 30 to 40 degrees depending on body habitus, and I would suggest using an in-plane approach. When you're injecting in and around the abductor tendons, if you're injecting, say, steroid, you may want to put it in between the tensor fasciolata and the gluteus medius tendon. You don't want to put it into the tendon itself. In contrast, if you're doing a PRP injection, you will want to do the injection directly into the tendon. But as with my previous videos, I recommend using a fenestration technique when you're doing the PRP injection. An alternative approach is to use a short axis view. Again, you can use the in-plane technique, but in this situation, bring the needle in as horizontal as possible, directly into the tendon if you're doing a PRP injection, but still using that fenestration technique. Or you can direct the needle to between the tensor fasciolata and the gluteus medius tendon if you're doing, say, a steroid injection for pain symptoms. Thanks for watching. I hope you found the video informative and it adds to your knowledge of musculoskeletal ultrasound imaging and interventions. If you did, please remember to hit the like down below, subscribe to the channel, and you can also share the video with your friends and colleagues. You can also follow me on Twitter and Instagram, and remember to check out sportsmedinfo.sg. Thanks again, and I hope to see you all very soon.